We did our industrial training at IMARET, which stands for the Islamic Medical Association of Malaysia's Response and Relief Team at Selayang. IMARET is a non-governmental organisation which focuses on disaster relief and providing medical services to marginalised communities which lack access to healthcare. However, during this pandemic, IMARET has also been actively supplying the essentials such as PPE and medical equipment to the frontliners at various medical institutions in effort to combat the COVID-19 burden. IMARET is also actively distributing goods and essentials to affected B40 families, especially those in isolation and quarantine due to COVID-19. IMARET also has recently opened up a clinic mainly targeted for refugees, which include general health consultation, procedure like wound dressing, vaccination, and antenatal checkup. There is also a shelter room provided for those in need of temporary shelter or accommodation before being transported to the hospital for further detailed medical examination.
This is the warehouse or the storage room located on the first floor to store all the items before they are being transported out whenever needed for an occasion. The items are like gloves, face masks, hand sanitizer, medications, metered spray, and many more. Most of the items are for COVID-19 screening. We were given a list of the items by the person in charge needed for the specific locations for COVID-19 screening, and we took out the items and rearrange them at the entrance according to the locations. There was a trolley which makes our work easier to move the items as some of them are quite heavy. We double-checked the list to ensure the items were correct and each box needs to have an IMARET sticker on it. Apart from that, we also managed to set up a clinic which is located on the ground floor. The clinic is called Clinic QFFD. When we first arrived, there were so many goods and boxes laying on the clinic floor. For the clinic to be ready to operate, we cleared most of the items by transferring them to the warehouse and the office on the second floor by steps. We distanced ourselves a few meters away, so no one will have to bring the items from the ground floor to all the way up. We were all sweaty and exhausted, but with everyone's help, we were happy that we got it done within just a few hours.
One of the things we had to do was help to set up the clinic. We started off by relocating all the medications to the office for a better workspace. Since there were no elevators, we were tasked to move boxes of medications up 3 flights of stairs. We then went through each boxes of medications to segregate them into their drug classes. All the medications were also checked for their expiry date. Drugs that were expired or near to expiring were isolated so that they can be properly disposed of. We then recorded the drug's quantity, batch number, and expiry date on the stop cards, which was then keyed in to the inventory list.
We were also required to key in the prescription details of the Rohingya patients or refugees that came to seek for medical treatment from the IMARET clinic. Some of the details were the patient information, the list of medication, follow-up, and also the diagnosis.
During attachment, we also had the chance to join and experience mass sampling for COVID-19 as volunteers. The event was held for free around Selayang community, which was organized by IMARET and Salcare. IMARET had been doing this free mass sampling since the start of COVID-19 pandemic. We were divided to different locations like Shah Alam, Klang, and also Petaling Jaya for different days. We were placed at the open lab where we need to screen the swab sample. Well precaution was taken as we need to wear personal protective equipment and use sanitizer each time after handling the sample. We use the standard F COVID-19 AGFIA set by ST Biosensor. It used the fluorescent immunoassay to detect SARS-CoV-2 infection in human nasopharyngeal swab specimen. The kit need to be rest for 30 minutes after dropping the swab sample. Then the kit will be inserted into the machine where it will show either positive or negative result. The negative result will be emailed the day after, while for positive result, the COI reading will be taken following further action.
Assalamualaikum and hello, I am Isrina Farina binti Ishaq. I had done my 2 weeks attachment at IMARET Selayang. It was very fruitful and interesting. What I've learned the most during my attachment is on how to manage the medication inventory. IMARET had just moved from Kuala Lumpur to Selayang, so all of the medication have been scattered away in different boxes. So Encik Shah, our supervisor, gave us tasks to classify all the medication back and according to the system and exclude the expiry medication. He also asked us to contribute on how to key in all the medication by using a very practical ideas. Another things that I learned during the COVID-19 mask sampling, where I learned how to donning and doffing the PPE accurately, and also how to use the ST Biosensor machine to screen the swab sample. That's all from me, thank you.
Hi, I'm Atika. So one of the things that I've learned throughout this industrial training is how important it is for a company who handles goods to have good storage practice in order to ensure the quality of their products or goods to be maintained at all time. Good storage practice can also be done to ease the process of distribution and also logistics. So for example, in IMARET, they label every boxes of medical equipment or medications that they have appropriately in order to ease the process of identification. Hence, they are making it easy for the logistic people to retrieve the desired products according to the request form. Other than that, I also learned how important it is to have a strong organization whereby everyone in their specific position should be able to carry out their specific task excellently in order to make a company successful.
My name is General Patricia, and one of the things I had learned during the attachment would be on warehouse management and operations. I got to learn how the warehouse at IMARET safely and securely store medical equipment and medications in an organized way before they are distributed, how they manage newly arrived items, and also the stock on hand. Other than that, I also learned a number of soft skills and their importance, such as teamwork, work ethics, and also communications. Finally, I also had the chance to experience the mass sampling for COVID-19. I learned how to properly don the PPE, how the samples were collected, and also how they were tested. Thank you.
Hi, I'm Farah. I would like to share what I've learned during my attachment days at IMARET. Before this, I never knew much about IMARET. On the first day of attachment, I learned about the amazing people behind IMARET who are passionate in helping the people in need despite their busy career. This inspired me to help the people in need and to contribute more to the society. Secondly, I think teamwork and communication are very important in getting the work done. They come in handy. Without communication between the students, the work will not be effective and may cause misunderstandings. With great teamwork, the tasks are easily coordinated and can be done in a timely manner. I've witnessed a great teamwork within ourselves during this attachment, and so I could say that we did a pretty good job. Some of the days are very exhausting, but we were content as we all had a great time together.